Hey guys, and welcome to your next installment of Design to Move. This is Ryan Maxwell. Today we're going to be targeting your rectus femoris. It's a big muscle that makes up part of your quad. Now this attaches your patella or your kneecap up to your hip, and it helps to flex the hip and extend the knee. The problem is that this muscle is often overused and it contributes to a muscular distortion syndrome called lower cross imbalance. That's basically where your hip tilts down anteriorly, putting a lot of pressure on your lower back. This is going to functionally inhibit your abdominal muscles and your glutes. That's why it's really important that we learn how to release this muscle and lengthen it so we can get back to a natural tension relationship around your midsection. Today we're going to show you how to use a lacrosse ball to break open the fibers and lengthen the rectus femoris so then we can activate our glutes, strengthen our midsection, and then integrate it into a position like a lunge so we can get some functional upregulation into your central nervous system. All you need is a lacrosse ball. If you have questions, you can reach out to us at admin@fluidhealthandfitness.com or check out our website at fluidfitnessandnutrition.com. Let's get started. This is an active release of your rectus femoris using a lacrosse ball. Alright, so we're going to use the lacrosse ball. Remember, the insertion of the muscle is at the kneecap. So you're going to lay on top of the ball just over your kneecap, and you're going to slowly roll the weight of your body down so that the ball comes in closer to your hip until you find your first trigger point. Often the pressure of a lacrosse ball may be too intense for those just starting with self-myofascial release. You may want to begin with a foam roller first, then progress to a lacrosse ball. As you roll down the length of your leg, you'll want to isolate the first tender spot by applying pressure until the intensity subsides. Only then, after it slowly dies down, would you bring your foot towards your butt in small increments, then quickly release and increase the pressure on the ball. This will begin to reduce the tension in the muscles, allowing you to get deeper into the fascial tissue. By releasing the rectus femoris, you'll be able to render a stronger contraction in the gluteals and hamstrings, giving you more stability in the hips and lower back. If you want to spend more time on this section, you certainly can. Pause the video, and once you're ready to resume with the next segment, get started. Nice work. This is a static stretch of the rectus femoris using just body weight. Okay, so now that we've broken up those collagen cross bindings on the rectus femoris, we want to stretch the muscle out and get more length out of it. So we're going to get into a kneeling position with our left leg down. Now I'm using a yoga block to create an extra flexion in my knee so I can get a deeper stretch through that rectus femoris. And then I'm going to anchor the hip by posteriorly tilting or rolling the pelvis under. From there, I'm going to draw my weight over the body. It's called a contralateral stretch, and then that'll set us up into the position. First off, it's important to note that you don't want to immediately stretch the muscle as far as you can. Since there is a reflex response to shorten an overly stretched muscle, this type of abrupt stretching can actually defeat our purposes. Take your time and in a rhythmic fashion, ease into the stretch with progressively longer extensions. Breathe out with each approach and encourage the muscle to lengthen. You'll notice immediately how much more effective this practice is. Since the rectus femoris contributes to an anterior pooling of the pelvis, and by extension your lower lumbar, releasing the tension in this muscle can help to reduce lower back pain and discomfort. Let's move on. So this is a prone left hip extension targeting the left gluteal using just body weight. So now that we've lengthened the rectus femoris, we have more mobility out of the hip and the knee. So now we want to target the glute. To get into the position, you're going to lay down flat with your stomach facing down. Get into a nice centrated position with your shoulders drawn back and your chin tucked. From there, bend your knee slightly and then lift the hip off the ground about a half an inch, making note not to go too far and go into back extension, then come down to a count of 4. All right, that gets us set up. The glutes are used in hip extension or the drawing of the leg behind you while you walk. There are 3 heads of your glutes: the max, minimus, and medius. The min and med attach directly to the femur, while the maximus attaches to the tibia or lower leg through the IT band. It's very easy for us to overuse the medius in this movement, indicated by an external rotation at the femur. You'll see this as your foot turning out as you lift the leg. Try your best to keep your kneecap straight down to the floor through the entire movement to focus on contracting all three heads of your glutes. Creating strong glutes goes a long way in preventing injury and maintaining your nervous system's control over your hips and lower back. Nice work. This is an integrated strength movement targeting your internal oblique using just body weight. So now that we've activated the glute, we want to get in and use the internal oblique that helps to stabilize the posterior tilt or pulling under of the pelvis. So step your feet out wider, just wider than your shoulder width, and sit down into your hips so that the weight is centered behind you into your middle line. From there, you're going to tilt your body to the right, reaching the arm over the head to lengthen through the internal oblique, and then bring your body weight back to center, contracting. Let's get started. Because the hip flexors pull the pelvis downward, this naturally lengthens the abdominal muscles like the internal obliques. We use these muscles to not only laterally tilt through the spine, but also to stabilize the pelvis when we walk. While performing this movement, try not to lean forward into your hips as a substitution pattern. Put your weight back into your heels and keep a neutral spine while emphasizing the tension through your spinal flexors, like your abdominals. There should be no excess forward flexion or extension in the lower back. If you focus on squeezing your butt, this should help to release the hip flexors from trying to kick in to help. We don't want that. Nice work. Let's get to the next one. This is an integrated strength position, isolating your anterior sling on the left side of the body using just body weight. Okay, so we're gonna step into a lunge. As we step forward, the weight's gonna come into the heel and the lead leg, this on our left side. That's gonna fire our glute, and at the same time, we're using our oblique to stabilize our pelvis. So we're using the adductors of the left leg into our internal oblique, across the linear elbow into the external. So as I do that, I'm gonna rotate into my lead leg, making note that my knee, ankle, and hip are all in a neutral alignment. Let's get started. This movement adds all the pieces together. Lunging forward recruits both the glutes and obliques to stabilize the pelvis and leg. Make sure to strike the ground with the lead heel, then allow the pressure to shift into the midfoot and toe box without allowing the knee to travel further over the toes. If you notice yourself falling forward, bowing or flexing over your back, make your step smaller and try to focus on maintaining an upright posture. Excessive forward leaning is a sign that you're overusing the front side quad muscles to absorb movement through the knee and not through your glutes and hamstrings. Coordinating the recruitment of the glute and oblique to facilitate proper joint movement will aid in creating efficient movement profiles. This reduces wear and tear. Let's move on to the next side of the body. So this is an active release of the rectus femoris using a lacrosse ball. So this time we're going to be targeting the right side of the body. Using the lacrosse ball, first find the insertion where that rectus femoris meets up with the patella and go just beyond it. We're going to brace the ground right on top of the ball. So laying down on the floor, prone or facing down, using the body weight, start rolling the ball in towards your pelvis until you find the first tender spot. Once you get there, we'll get started. By contracting, then releasing the hamstring while isolating the rectus femoris with the fascial release ball, this will work with your body's central nervous system to encourage a release and tension in the muscle itself. This will initiate a lengthening response. By doing this, you'll be able to get deeper into the fascial tissue, increasing circulation, and over time, decrease the fascial tissue itself. This is important to establish the proper balance of tension around the hips. Let's move on. Now we'll do an active release of the rectus femoris on the right leg using just body weight. Okay, so now that we've broken up those collagen cross fibers and we've isolated the first trigger point, you're going to start to see if we can lengthen those fibers and break open the tissue that's been bound up. So you're going to place a yoga block or a bench or something behind you and then posteriorly tilt so that you get a nice deep stretch to the knee. Be careful if it's too tense or if it pulls too hard. Drop the leg down. Maybe just the length of the knee on the floor is sufficient. From there, posteriorly tilt and tilt over the body. That gets us set up. Let's get started. Changing the angle of flexion at the knee will aid in establishing the right amount of pull necessary for you to get an adequate stretch. As the rectus femoris attaches to the patella or kneecap, by bending or extending the knee through the attachment point, this will further reduce or intensify the stretch. You can brace your foot behind you using a bench or step to accommodate this. Flexing and releasing the glute while holding the stretch will aid in the nervous system being able to release the tension in the quad muscle. Many people experience runner's knee or a general pain in the knee due to excessively tight rectus femoris muscles. This should help to alleviate the pressure on the knee. Okay, let's finish up. This is an activation of the glutes using a single leg hip extension on the right side. Okay, so we're gonna lay back down prone. Now that we've broken up and lengthened the rectus femoris, we're gonna see if we can get the reciprocal to fire up the glute. So laying down, bend the knees slightly to lengthen through the rectus femoris and quad muscles. And then you're gonna lift your hip up slightly, just so far that the leg comes up off the ground, flexing the glute, but without hyperextending into the lower back. It's a count up for 1 and then a slow count down for 4. Let's get started. Try not to overextend as you lift the leg from the ground. Since the glute is in opposition to the quad muscles, if the released rectus femoris muscle still isn't at its natural resting length due to fascial or neurologic restrictions, you may have a tendency to recruit your lower back extensors to compensate for a lack of strength in your butt muscles. This substitution pattern can reinforce the maladaptive movement pattern seen with lower cross syndrome, essentially defeating our efforts. As your tension relationship develops into a more balanced state, you will be able to lift the leg higher. For now, focus on form and precision. Nicely done, let's move on. This is an integrated strength movement of your internal oblique using just body weight. So now that we've lengthened the rectus femoris and we've activated your glute, let's get in and create more stability out of the muscles that stabilize the pelvis from even tilting down in the first place, the internal oblique. So straddle wide so that your feet are outside the width of your shoulder with your toes rotated out about 15 degrees. Tilt your tailbone under and sit your weight back into your heels. From there, tuck your chin, rotate over the body, laterally tilting over the spine, and then bring your body weight back to the right side. Let's get started. Individuals oftentimes allow their hips to sway out on the side of the midsection being worked in this exercise. This is a natural releasing of the glutes and IT band responsible for stabilizing the pelvis through the lateral sling system. To truly isolate the internal oblique, keep your glutes flexed and maintain a level pelvis. The movement should be isolated between the rib and the hip on the side being targeted. No movement should be seen in the knees or in the hips. Since your obliques aid in stabilizing your pelvis as you walk or during functional activities, strengthening these muscles will help to keep you balanced and allow you to transmit forces properly through your midsection. Okay, on to the next movement. Now we'll complete a strength movement isolating the anterior oblique sling system using just body weight. So now we're going to incorporate all of this into a big plane of movement or big global movement system using the glute and internal oblique as we come down into basically a lunge with a wood chop, asking our glute to stabilize the femur and pelvis along with the internal oblique, bringing the arms across the body and then pushing off the heel and coming up to a neutral position. That's our movement. Let's get into it. Try to keep a wide base of support when you step forward. Often folks create a narrow stance, almost like walking a tightrope due to weakened gluteal muscles, relying on the inner thigh muscles for stability. By widening your stance to shoulder width, you'll increase the recruitment of your glutes and gain a greater base of support, placing less stress on the knees. This also should keep you more upright, reducing the stress on the lower back. As you rotate across the body, keep your gaze fixed and straight ahead without letting your head tilt back at the bottom of the lunge. This will help to maintain your center of gravity and allow you to recruit your inner core more effectively. The integration of global movements like these that challenge your Okay, so this brings us to the end of our Design to Move segment on the rectus femoris. Remember, this is just one of a series of muscles that contributes to lower cross syndrome, or that muscular distortion syndrome that pulls your pelvis forward. Now, because the lumbopelvic hip system, or the pelvis, the lower spine, and femurs are the epicenter of movement and how we maintain our balance and coordination, really important that we learn how to assess and make sure that we keep this in a balanced position. So today is going to go a long way towards helping you establish that neuromuscular efficiency around the lumbopelvic hip system, releasing the rectus femoris, activating the glutes, learning how to isolate the posterior tilters like the internal oblique, and then adding it all together into a global movement like a lunge or your gait. So if you have more questions, reach out to us at admin@fluidhealthandfitness.com or check us out at fluidfitnessandnutrition.com. We would love to hear from you. Remember, your body was designed to move, so stay in motion, and we will see you for next segment. Bye-bye.